Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're going to be talking about how to give eye drops. So the first thing we're going to do, because this is a medication, we're going to consult our MAR, make sure everything checks out, we have the right patient, we've checked to see if they have any allergies, we have the right dose, the right time, the right medication, the right route, all of that is correct, right? So that's our first check. Our second check, now we're actually going to get our medication and we're going to compare our medication to everything it says on the MAR. Yep, it all checks out. And then we also want to check the expiration date on our medication to make sure it's not expired. So we've done our first two checks, everything's good. Now we're ready to actually go into the room. So we're going to wash our hands, we're going to provide patient privacy, and now let's go identify our patient. Before we give this medication, we should also put on gloves. Hi, Mrs. Johnson, I'm Andrea. I'm going to be your nurse today. How are you feeling? Oh, that's wonderful. I do have some eye drops to give you. Can I please first verify your name and date of birth? All right, that's what it says on my MAR. It matches up. Great. Now, I do have one more question before I give this. Do you have any allergies? No? Okay, wonderful. So these are your eye drops. They were ordered by your doctor to treat your eye infection. Do you have any questions about this medication? No? Okay, that's great. So let's get you into a position. I want you to be a little bit more flat, and once I get you flat, I want you to be looking up at the ceiling. Okay, now we're ready to give the medication. With the patient in a supine position, you're going to have your non-dominant hand hold a Kleenex and your dominant hand hold the medication. Your non-dominant hand is going to go on the patient's cheek, and then your dominant hand is going to rest on the patient's forehead. You're going to ask the patient to look up towards the ceiling while you do this. You also want to let them know that they might have a slight burning sensation when it happens, but that should go away. So we're ready to do it. So we have our drop. We're going to hold it about 1/2 of an inch away from the eye. We don't actually want to touch the tip to the eye because it could spread the infection. So about 1/2 an inch away, drop it. Naturally they will blink because they're not a mannequin. And then you can wipe gently with the tissue. And sometimes they just want to do the tissue themselves. You can hand it to them and then they'll wipe themselves. So that's how you do it. Pretty simple. You just want to make sure that you get them in the right position and that you kind of have your hands in the right position when you're doing it. So non-dominant hand on their cheek holding the tissue, dominant hand on their forehead holding the medication. So that was my video on how to give eye drops. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.